45-year-old reality show star disclosed this in a teaser for the 7th season of her show, The Kardashians, which premiered last week on Hulu. In the clip, she refers to it as a, quote, little aneurysm and suggests that it may be related to stress. But brain aneurysms are more common than you might think. With more on that, let's speak with our medical expert, Dr. Payal Kohli, adjunct professor at at Johns Hopkins and Duke University. Thank you, Dr. Kohli, for joining us this morning. So she referred to it as a little aneurysm. Tell us more about how common aneurysms are.
Good morning to you all. So aneurysms are essentially a bulging or ballooning of the wall of the artery, and they can in fact happen in any artery in your body. They most commonly happen in the aorta, which is that big blood vessel that carries all the blood out of our heart. But if they happen in our brain, they can be called cerebral aneurysms or brain aneurysms. And of course, being smaller predicts a better outcome just because they're less likely to rupture or burst. We don't routinely screen for them, so we don't know exactly how common they are. But the American Heart Association predicts that about 3 to 5% of Americans will have a brain aneurysm. We know that women have it more commonly. We know that it usually gets picked up between the ages of 30 to 60. And we know that after menopause, the risk can increase. Certainly, a lot of our lifestyle factors, high blood pressure, smoking, alcohol use, stimulant use, these are all factors that can contribute to aneurysm formation.
What are the symptoms, and when, if ever, should we seek help?
This is the hard part about this.
Yeah.
There may not be any symptoms. So if you have a cerebral aneurysm, only if it's large enough to push on something else, such as the optic nerve, which allows us to see, for example, you might start having some visual symptoms, blurry vision or vision field cut. But most of the time, there's no symptoms. So really, it's only picked up what we call incidentally, or getting brain imaging for some other reason. You have a headache or something, and they end up finding the aneurysm. Now, there are some subset of patients who should get screened for aortic aneurysms. And if you're a man between the age of 65 and 75 and you've ever smoked, then you probably need a one-time screening for an aortic aneurysm, not in your brain. But for most of us, we don't need to be screened if we're average risk. Now, if we have a family member who's had an aneurysm, so Kim Kardashian's family members, for example, and they have another risk factor, or you've had 2 or more family members without any other risk factors like high blood pressure or smoking or anything like that, then you probably do need to get screened with an MRI that looks for that bulge.
You touched on this. Kim Kardashian mentioned stress as a potential cause of her aneurysm. What happens to the body during stress? What's the connection there?
Yeah, so we haven't directly looked at stress and aneurysm, but we know that if you think about a water balloon rupturing, the pressure inside the water balloon is really high. That's going to make it more likely to pop or to rupture. And stress can raise our blood pressure, certainly. Stress can also release cortisol, which is a hormone that can cause, excess glucose in the body, that can poison the wall of the blood vessels. It can cause inflammation in the wall of the blood vessel, which also makes it more likely to tear. And chronic stress, we know, has been significantly linked to having all kinds of blood vessel diseases, including aneurysm. But certainly other factors, like I said, including, factors like smoking, factors like a lack of estrogen. So she's only 45 right now, but once she hits menopause, we perhaps want to be thinking about screening her aneurysm more carefully, because there's certain predictors of what makes it likely to pop.
And Dr. Kohli, what are the treatment options for this if you do get diagnosed with an aneurysm?
So it really just depends on the type of aneurysm. So that means the size. Now, Kim told us she had a small, tiny aneurysm, which is good, which portends well. It depends on the location. There are different parts of the brain that are more likely to experience that hemodynamic stress, that stress inside the aneurysm. They're more likely to pop. It depends on how quickly it's growing, and it depends on the shape. If there's lobules or irregularity to it, it might be more likely to rupture and pop. So really, we start screening patients with serial imaging. So she's going to probably need an MRI every year, every few years, depending on the size and what the screening plan is. If it's growing too quickly, they might think about doing something like clipping or coiling. So they can go in through the groin and get to the brain and coil that aneurysm going through the artery in the neck. Sometimes they'll do an open surgery, but that's usually unlikely. These days, they do minimally invasive options. If they decide that it's high enough risk for rupture that they need to actually take care of it, they either cut it off or they coil it. If you do get an open operation, you might end up getting a graft inside to make sure you have, an intact blood vessel if it does pop.
Dr. Payal Kohli, thanks for being here once again on Connecting America. We really appreciate it.